For today's webinar, we're joined by Arianna Anaya, Training Coordinator for Foundation Communities, and Arianna will provide strategies to help you support your clients in understanding how health insurance works, evaluating and comparing marketplace plans, and selecting the plan that best meets their family's needs. And with that, I'll turn it over to Arianna.
Hello, thank you so much for allowing me to be here, and thank all of you who are attending. I'm very excited to be a part of this presentation and any presentation associated with Beyond the Basics and Center on Budget. So for today, we are going to talk, let me go back one. We are going to focus on three things. For the first part, we're going to talk about how you can make use of the enrollment process to explain exchange plans and terms. So specifically providing something of an order of operations when it comes to plan education connected to the actual exchange. For the second part of the presentation, we're going to talk a little bit about comparing plans. So starting to an extent with what exchange plans have in common and how to explain that to clients, and also explaining to clients how exchange plans differ. And for that piece, we're going to focus on cost and network. In the very final part of this presentation, we're going to give a little bit of plan selection tips and also some information on some tools for assisters that in theory, you or someone at your organization could build just to get you guys all on the same page, connected to certain talking points as relates to your individual market. Okay, so just to make sure we're on the same page in terms of acronyms and different terms, I will probably say healthcare.gov a lot, and this is because my organization is in Texas. So because we do not have a state-based exchange, we rely on the federal healthcare.gov, what's also called the marketplace. So if you hear me repeatedly mentioning healthcare.gov or the marketplace, forgive me, it is simply because it is the portal that I am most familiar with. However, states that have their own exchanges tend to look very similar to the marketplace, luckily. So most of what's said here should apply. PTC, of course, is going to apply to premium tax credit, the first piece of financial assistance people may or may not be eligible for. CSR, referring to cost sharing reductions. The other piece of financial assistance, I use assister usually kind of interchangeably with certified application counselor and or navigator. And applicant is kind of the general terminology that I may use to refer to a patient, a consumer, or just the client who is being assisted. And then finally, resource is generally going to be terminology utilized to describe a tool. And any tool that I'm mentioning in this presentation is one that you are all absolutely welcome to make use of. Okay, so just to get started, we're going to talk about using the actual enrollment process to explain marketplace and exchange plans. So again, kind of an order of operations for when you are providing education to a client in terms of their different health insurance options. So a couple of things that I hope to get us all on the same page about, and I think these are things that we all know, but perhaps don't necessarily say out loud. And I think the first piece is, that health insurance is often made more confusing and convoluted by the different terms and by all the bureaucracy that is built into it. So the top priority of any assister, of course, has to do with access and providing education. And I think it's okay for us to admit that learning about health insurance is actually not the most fun thing. Many people, unfortunately, are literally turned off by how confusing it is and the fact that they may be more or less familiar with the terms. I think, too, it's important for us to acknowledge that regardless of how much time we take explaining all these things to clients, they will not necessarily retain every last thing that's explained to them. So ensuring that clients leave your sessions with the most important pieces that relate to their health insurance, but also with resources through which they can contact you or your program with follow-up questions throughout the year, to my mind, is one of the most important impressions you can leave a client with, making sure they understand they're not alone with this plan, right? That we are around as a resource all year to assist people. So the screen you're looking at right now is the healthcare.gov marketplace enrollment checklist. And essentially, you can see that it's numbered from 1 to 6, as well as possessing this optional bottom option that I'm going to talk about first. Before we get into it, though, I wanted to start by letting you guys know my sample client is a married couple. They do not have children. The husband is 49 years old. The wife is 37. They are non-smokers with an estimated annual income of $27,000. So for a household of 2, this puts them at about 155% FPL. And I've placed them in Austin, Texas, which is, of course, where my entity is. Obviously, the challenge of doing a presentation at this point in time is 2022 plan options has not yet been released. So these slides are as accurate as they can be at this time, but do hopefully keep in mind the caveat that 2022 information is not yet totally accessible, but these screens are up to date as of the end of last month. So hopefully they are representative of what you guys will see to an extent. So to start, I'm going to talk about that very last optional slide. So for this optional slide, I think this can be a bit of a confusing piece, and I assume many people skip it. But what I want to emphasize here is what the marketplace does is it sets up a way through which you can essentially make each plan that you show clients, kind of show them essentially the quote unquote worst case scenario financial situation. And if you wanted to take advantage of this to clients as part of your ongoing practice, all you would need to do would be to indicate that the client expects quote unquote high use for the year. What this will do, as you can see in the left-hand corner, is automatically figure out the total annual costs connected to a client paying their premiums all year and essentially hitting their out-of-pocket max. So basically the premium multiplied by 12 plus their max gives you kind of, if all other things that can happen medically go wrong, this is your worst case scenario. So what I would recommend here is that if you're going to get this, if you're going to use this, use the high use option, because the low use option won't necessarily be meaningful in terms of a statistic. But the high use option is useful because if someone is talking about potentially having a surgery, or if it's someone living with HIV or other very complex and high cost needs, it essentially lets them know in summary how plans compare connected to this quote unquote worst case scenario. I do want to emphasize though that when we talk about worst case scenario, this presumes of course that clients are receiving covered and in-network services. So do keep that in mind. Okay, so going back to our checklist, the very first step is going to be assisting clients with understanding how much of the premium tax credit they want to use. And I think this can be a confusing moment for clients. What we tend to emphasize when it comes to this slide is that clients are eligible for this full amount. Most people will use the full amount in order to most be able to afford their health insurance. Would they like to use the full amount? And what this does is it de-emphasizes a situation where a client may try to sort of jury rig a reconciliation situation where they say, okay, well, what if I use some, right? And what sometimes happens here is an assister will spend more time than is necessary trying to ensure a client doesn't need to worry about reconciliation when it comes to their taxes a year from now, where likely the better way to ensure clients don't have to repay all or some of their premium tax credit is to encourage them to check back in with you if a change happens to their income. So rather than trying to manipulate the amount of PTC, help them keep focus on the actual income estimate, which is something that they will have better control of ultimately anyway. So the second step in our enrollment checklist is going to be talking about tobacco use. And The marketplace does helpfully have sort of the legal definition in terms of whether or not someone is a tobacco user, which is going to be within the past 6 months, 4 more times per week, excluding religious or ceremonial uses. So if you start with the question, are you a tobacco user? And the person kind of responds a little sheepishly, you can follow up with that, right? And then generally they will give you a yes or no answer. And at that point in time, if it's yes, you will need to indicate the last time that they used tobacco. I think keep in mind, you can be very literal with the definition here of tobacco use. Chewing tobacco, as an example, is literally tobacco and thus counts as tobacco use. Whereas if someone is an e-cigarette or vape user, if what they're vaping contains tobacco, that is a tobacco user. But if it does not, that is not currently considered tobacco use. The next part of the checklist is going to enable you to enter doctors and facilities for the client into the marketplace search tool, and also to theoretically enter prescription medications. I'm going to look in a little more detail at both of these tools, but what I would like to emphasize here is that, firstly, the marketplace overview tool can be very helpful as a starting out place, but it is essential that you re-verify all of this information within the individual plan directory or formulary, which is where you look up providers and medications. You do not want to just rely on this tool because it is not always 100% accurate. What I would also further advise is that the doctors and facilities tool tends to be a little bit more useful and user-friendly than the prescription drug tool. And I will show you why in just a moment. So firstly, what you guys can hopefully see here is I've done 2 separate searches, one for a specific physician and then one for a specific facility. And what will generally happen is you will see a long list of either doctor's names or facility names, and you will need to pick one. And you get some clues in the search results, such as how far away it is and the location, which can be helpful in terms of narrowing down which it is. What this then translates to when you're looking at actual plans is towards the bottom of the plan shopping window, there will be essentially a little box that says the medical providers in network, and it will give you this X if they're not in network. So again, this can be a wonderful starting out point, but I would always double check this information against the actual provider network. Sometimes the way the marketplace has their name in is different than how the doctor's name appears in the directory. There's a whole different number of issues with why this information may not be entirely accurate. So do not go with this information alone. Use it as sort of a starting out point when it comes to narrowing down plan options. This next screen is to illustrate why I find the prescription drug tool not as helpful. So what I've done here is I've looked up a medication called sertraline, and you'll notice I've looked up 3 different dosages of that. But then you can see there's also a medication, Zoloft, and Zoloft is basically the brand name of sertraline. The challenge here, as you can see on the right-hand side, is the way this is going to show up on the plan side is just green check mark saying yes for sertraline. But what it doesn't show you in that screen is which doses are or are not covered. But then problematically, if you can imagine a client who doesn't know that sertraline is the generic form of Zoloft, if you had just looked up Zoloft, you would be looking at a variety of plans likely saying that Zoloft is not covered, which might technically be correct, but the challenge here is ensuring that you're looking up as well the generic option. And then finally, the biggest challenge is it's giving you a yes or no answer when it comes to medications, when the answer is actually more complicated. Obviously, a medication being covered is important, but the secondary piece is what is the cost for that medication to be covered? So keep in mind, this is a starting out point. It's not your final step. Your final step needs to be looking up the medication tier in the actual formulary connected to the specific plan. Okay, If you're dealing with more than one individual in a plan, you do need to pay attention to the groups. I find it very, very helpful to make sure people are aware of the fact that two members of the same household do not have to be in the same group. And I think sometimes we forget this because for the most part, clients want to be in the same group as their husband or their wife or their children, right? Understandably. But occasionally, I think we will encounter situations where one of the two members has a very high medical need, and perhaps the other member just wants a plan that, if they have a life-threatening emergency, ensures that their costs won't get out of control. But they don't care about copays. They're not looking to be in the same plan as their spouse. So this is where, in theory, you could, if necessary, switch the groups around. And so essentially, if you were to hit the view plans option, that would take you into the shopping tool, but looking at plans with husband and wife together. But you also have the option of using the change groups option and putting husband and wife in separate plans if you wish. You can, of course, also start by looking at the two together in a plan and return to the screen, and then looking at plan costs separately, which is what I tend to recommend. Look at the two individuals together, and then if there is an issue with the cost or an issue in terms of someone needing a different level of coverage, then change the groups and shop individually. But for the most part, it tends to make the most sense to look at all the individuals in the same plan to start. I have a couple of just reminders connected to grouping because I think grouping is a little bit confusing. Be aware that if you are looking at a plan with more than one person enrolling, the marketplace tends to show the family deductible and the family out-of-pocket max instead of the individual one. You would need to open the plan details to actually also see the plan's individual deductible and out-of-pocket max. So, and also keep in mind, for the most part, broadly speaking, the individual deductible will be half of the family deductible, except for cases where there's an aggregate family deductible. So again, the best way to double check that is to ensure you've checked the open plan details button, which I will mention in just a bit. Also keep in mind that there are some rules connected to who can be grouped on the same plan that I've outlined here. Now, all family members can, regardless, pick the same plan. However, they can't necessarily be on the same plan together, if that distinction makes sense. And what I would especially call attention to is if you've moved to the plan selection and instead of looking at the usual 71 plans, you're only seeing 30 or 40 or 10, and you're wondering where the plans went, it is quite possible that there's an issue with the grouping. And I have a couple of examples listed below. For example, a married couple with 2 children who are under the age of 26 may all be grouped on one plan together. But if they have adult dependents who are also in the household, such as the wife's elderly parents, those parents cannot be grouped on the same plan. If you try and group them together, it will create this error if it lets you look at plans at all, where not all plans are showing. Likewise, certain plans will not allow 2 siblings without a parent to be grouped on the same plan. So be aware of that. We've seen situations where people get stuck connected to the fact that they're kind of grouping irregularly in terms of health insurance rules. And that is what messes up their ability to see all the plans. Whereas if you put each sibling in their own group, you could enroll each of them in quote unquote the same plan, but they cannot be enrolled together. At this point, you will see sort of an overview of the tools that the marketplace makes available. I find the filter feature really, really helpful, not just, of course, for working one-on-one with clients, but particularly when it comes to building resources for my team. As soon as the plans get released in late October, always very late October, which is fine. It's kind of a mad dash for me to use the filter plans feature to get as much information as I can for my team and to build some of the resources that I'm going to give you guys a brief preview of a little later on. But always be aware of that filter plans feature because it can really help you narrow things down. And likewise, the compare plan feature can be very useful when it comes to helping clients look at more than one option simultaneously, which is highly recommended. Okay, so to start at this point, once I actually get into the plans, what I will do is give the client sort of a summary of the marketplace generally. So for our market in Austin, Texas, I would let them know, and this is kind of my script, that they've got 71 total plan options available from 6 companies. I let them know that the plans are organized in terms of the monthly cost. And the biggest difference between these options comes down to 2 things, okay? The cost and also where you can use it, where you can get care. And I just want to emphasize that where I get this information connected to the 71 plans and the 6 different companies is in that filters part. And again, that filter section, intended or not, gives you quite a helpful summary of the options in the market. You can see information such as a list of the different coverages available, the different companies, as well as the only 2 health plan types in this market. You can see there's exclusive provider organizations and HMOs, no PPOs, no POSs, right? This can be helpful if you're working with someone who said, I want a PPO. Right off the bat, you can manage those expectations for them. You can let them know that is not an option in the specific area for whatever reason, okay? So my acronym, and I apologize for having an acronym. I feel like we have too many acronyms in our health coverage world, but my acronym to kind of remind us what we need to do when teaching health insurance terminology and function is DEFT, because health insurance educators must be DEFT. It's kind of an old school word. I don't know that anyone says DEFT anymore, but anyway. Firstly, define it, right? We definitely want to make sure that clients understand what the word means and define it, I think, in as regular language as possible. Explain how it works and then connect it to the actual marketplace plan. And then I always recommend at this point, check in. Make sure the client understands where you're going with this so you can actually build on their understanding as you move through the terms. What my team tends to do is we will select a plan, usually a silver plan, that serves as our kind of education guidepost. And it's usually a plan we become very familiar with over the course of a season because it's the plan we will simply tend to use just to explain how the marketplace plans are laid out. You guys can see on the right-hand side my little script for how I would usually go about explaining this to the client. But I work from left to right, starting with the monthly premium, just giving them basically a quick definition, and also, of course, explaining exactly what it would be. And you'll notice little details such as specifically indicating to this client that this premium is for you and your husband, right? They may not know that. That may not be obvious to the client. They might be thinking it's going to have to be $26.20 a month versus $13. So as much as you can clarify those things as part of your initial explanation, the more time you'll save and the more clarity the client will have as you go. So as we get to the deductible, of course, this is another reason to use a silver plan is because the deductible will more likely be a separate value from the out-of-pocket max. Obviously not always, but you can see again my definition here that with many plans, you're responsible for paying the cost of your care before the insurance company kicks in and starts paying, and that's called the deductible, right? So another way of defining it is what you pay before the health insurance company starts sharing the costs. And then again, making sure the client understands the family deductible here, because this is 2 people on this plan, is $1,000, but specific to this plan, each person would have an individual deductible of $500. So at this point, we'll pivot down to talking about whether plans have copays. And of course, you always want to make sure clients understand that they should double check if the copay is subject to the deductible or not. But with this specific plan, There's a set copay for generic medications and primary care visits of $10, and then a $20 visit copay for specialists. And sometimes this is where clients need an explanation of what a specialist is or even what a primary care doctor is. And again, you're managing to sort of tick off each of these boxes as you gently work your way through explaining the shopping tool part of the plan. And then I think reiterating here that these, depending on the plan, are often services that a person is eligible for at that flat copay rate without having to first pay the deductible, and making sure people see when a plan has that value, because sometimes people don't understand that. They think they first have to pay the deductible regardless, and frequently that's not the case. So making sure, I think, the client understands the distinction between the deductible and the out-of-pocket max, I tend to recommend using a scenario. And the scenario I tend to use has a high cost associated with an unexpected medical need. So I tend to illustrate this. And often if I'm with the client, I will write this down and show them. But of course, we've been working remotely for a good amount of time. So I've asked them to stop me if I'm confusing them. But basically with this plan, I let them know that if they had a care that's not covered by a flat copay, let's say an ER visit, an emergency room visit, they would be responsible for paying the $500 deductible. There is additionally a $500 ER copay, so they're paying the first $1,000, and then responsible for a 20% coinsurance connected to it being an ER visit, right? So if we are telling the client the ER visit costs $20,000, which is just, kind of a made up number, but functional for our purposes of explanation. You pay the first $500 deductible and then the $500 emergency room copay. And then you're responsible for 20% of the remainder, which is going to be $19,000. And 20% of $19,000 is $3,800. So basically what the client would be theoretically responsible for would be that $1,000 plus $3,800, except of course that the out-of-pocket max caps their liability, right? So the total the client would be responsible for that out of that worst case scenario emergency room visit is actually that $2,850. And assuming they, of course, avail themselves of covered services and stay within the network of providers, once they've hit this amount, their care must be covered 100% by the health insurance company. I find it very important to reiterate that they do have to make sure to pay their premiums, because sometimes people think, well, if I've hit my max, then I can stop paying my premiums. And of course, that is definitely not the case. That's the last thing you would want to do. And to also emphasize that the client would need to continue to utilize the network of providers and must be availing themselves of covered care. So for example, you couldn't hit your max and then get a cosmetic surgery covered by the health insurance, right? Health insurance doesn't cover cosmetic surgery, and so it's not going to work to hit your max and then expect the plan to pay for things that are generally not covered. Okay, so if we're looking at this larger screen with the overview of the plan information, and this is the screen as it would appear with a list of different insurances, what I did want to call everybody's attention to is that plan details screen, because that's where a lot of additional essential information is kind of concealed. So be aware that that exists. If you do click that plan details screen, this is the very first thing you will see, an overview of the monthly premium, the deductible, the out-of-pocket max. And you can see as well that it is differentiating between the individual and the family, which is helpful because the earlier screen did not do that. So it's a way to kind of double check that this is not a plan with an aggregate with an aggregate family deductible or out-of-pocket max. This spells it out for you. So I want to also highlight that this screen, if you're scrolling further below that highlight section, has a lot. And I think in theory, it's helpful that they've placed so many things in different places, but knowing where the essential items is will save you a lot of time. So what I want to earmark for y'all is that the plan document section contains the summary of benefits, the provider directory, and the list of covered drugs. This is very, very essential, I would say, each of those things. If you need additional clarity on the costs of certain more specific services than what is overviewed in that main plan screen, the summary of benefits is absolutely your best bet. Meanwhile, the provider directory, of course, is where you should be able to locate individual information on specific providers, hospitals, and auxiliary facilities that clients are interested in knowing whether they're a network or not. Do not just use the marketplace's tool. Make sure you double check the provider directory. And then lastly, in that plan document section is going to be that list of covered drugs, what's called the formulary. And that, I would say, is kind of where the majority of what you will need for an appointment is located. Note that if you pull open that second menu, the cost for medical care, there are some highlights written out, which can be helpful, which I've listed below. So the individual and family deductible and out-of-pocket are listed, the primary and specialty visit copay, and then the cost for imaging and labs is listed. So that can be helpful. But again, all that information will also be included in the summary of benefits. So be aware that there's duplication here. And I think as you get into explaining plans more and more, you'll naturally decide what's most helpful for you in your explanations. Finally, likewise, the prescription drug coverage screen also lists out the costs of medication based on how they're tiered. So basically, medications are essentially assigned a number, and that number will correlate to what the cost is for that medication and whether one must meet a drug deductible or the individual deductible prior to paying that set rate, if there's a rate. So again, if you pull open the prescription drug coverage menu, you will see the tiers listed out. But again, that information can also be located in the summary of benefits, which has a more comprehensive overview of all the specifics of the plan. And again, the medication lookup is also in this area. Okay, I'm going to move on into the talking about plans compared to other plan sections. Just to remind everyone from earlier, we will be taking questions at the end. So I see a couple of questions popping up in the chat box, which we will do our best to get to. So just to start, what I always recommend, we have 71 plans this past season. We've had over 100, and that can seem rather unmanageable as a task to distill through however many plans in the space of an hour, right? You could in theory spend an hour comparing 2 plans easily. And so what I highly recommend is beginning after you've provided the education part, after you've sort of gone over, here's how the plans are laid out, connected to their function. Start by reminding clients what the plans have in common. And I think this is key because often at the beginning of your appointment with a client, you will have given them the rundown on the Affordable Care Act and the guarantees connected to it. But by the time you've gone through an entire application and all this plan stuff, they may have forgotten some of those guarantees. So what I always start with right after I've done that plan training is just to remind them that all plans have to meet certain standards. And the first, of course, is that minimum standard of coverage piece. Again, what this entails is that you cannot, there cannot be the exclusion or charging more for pre-existing conditions or certain medical needs. And then also that the 10 essential benefits must be covered by every plan. Now, of course, how these things are covered and what you pay is going to differ. But these are things that all the plans fundamentally have in common. And what this does is it takes off the table the kind of confusing conversation of what's the plan that covers cancer, which clients will say. They all cover cancer, right? The conversation should never be about which plans cover X medical need. Rather, the conversation is specific to the client's needs. Where do they want to go for treatment? So starting up front with this reminder will save you quite a bit of time. So the 10 essential benefits are laid out on this beautiful slide designed by Beyond the Basics. I will admit I'm not responsible for this slide. And I would highly recommend, I think, emphasizing things like mental health as one of the key spaces, prescription medication, and then maternity and newborn care as places that people sometimes express concerns over. But to an extent, all of these things are considered medically necessary as far as the Affordable Care Act goes. And accordingly, plans through the marketplace cannot just exclude them. So again, if we can get on the same page about these things as a starting off point with clients, that means we can start to talk about plans, in comparison to other plans, starting, I think, with notions of cost, right? And when I say cost, I want to make sure I'm emphasizing that this is kind of a two-part conversation, a balance of what you're actually paying for the plan, the premium, with the costs of what your care needs are going to be, which is also hard because a lot of people won't necessarily know. So cost being our first factor, and the network where you can use the plan being our second important factor. And if we can focus on these two items, plan selection becomes a whole lot more manageable. So just to give you guys a sense, these are 3 plans offered in the Austin area network, and they're all offered by the same provider, the same QHP, Scott and White Health Plans. And they're all silver plans, actually. But you can see here that the conversation I'm having with a client can connect to 2 things when it comes to cost. It can either be about the monthly premium, looking at the far left-hand side, that plan is going to be free each month, whereas the plan on the far right would cost $81.91 each month. Now, looking down, you can see that the reason for this, the reason that plan on the far right is more expensive is because it has a $0 deductible, right? And this is kind of a classic setup of a plan. A higher premium tends to mean a lower upfront cost, specifically in terms of the deductible. But depending on the conversation you're having with the client, if you had used that high use tool that I mentioned at the very beginning, you can actually let them know, you can actually call their attention to the fact that all other things being equal, the worst case scenario situation for the least expensive plan would actually be less expensive than the most expensive plan. But again, this is going to come down to their needs, right? So if we go to the next slide and we're comparing, for example, laboratory costs with plan number 1 to plan number 3, it might be advantageous for someone who, let's say, is expecting to have a lot of x-rays or a lot of labs. We can see that that more expensive plan has a set copay of $50 for labs. So again, while the ultimate cost of that plan might be more expensive in terms of the monthly premium and the out-of-pocket max, the copays associated with a specific service that the client might want are actually, in theory, going to make it less expensive with the $0 copay. So the trick here, I think, is really emphasizing what the out-of-pocket max does and how it protects them in all of these plans, but also ensuring they understand why a deductible is, when it is important and when it isn't. And that frankly comes down to them, right? All right. And just to mention again that when an insurance company offers more than one plan option in the same type of plan and at the same metal level, this is really something that tends to trip clients up, I would say. They always ask us, what is the good one? Which is the best one? And I think really emphasizing at that point, it is simply a matter of personal preference, right? Some people want to pay more in order to have a copay. And some people, that's not important to them, right? Some people have an issue with having a deductible. They've had bad experiences with it, or they've heard bad things, and they're prepared to pay a higher monthly premium in order to have a $0 deductible. So the reality is there's no best plan. This comes down to their own comfort and their preference with how the plan works. I'm highlighting some kinds of questions that clients will ask, this sort of what if place, what if this happens, what if that happens? And what I would always recommend in terms of a pivot here is just to reiterate how the plan structure works, right? That the out-of-pocket max is really going to dictate your sort of worst case scenario situation, right? Rather than engaging in a conversation where you're measuring out percentages of co-insurance connected to a certain unknown cost or need. Always, at this point in time with kind of these unknown questions, I would recommend pivoting to the logic of it, right? The out-of-pocket max kind of being when the health insurance company is obligated to pay 100% of your in-network covered services. So again, too, you can literally point them to that place on the screen if you've used that high medical needs option. You can literally say, hey, this plan, if you have an accident or emergency or high medical needs, here's what your 2022 financial situation would look like. It's the monthly premiums plus the out-of-pocket max. So that would be the conversation connected to cost. As you can see, we have 3 different plans here. And so here is the conversation connected to network. And I find that people are either very, very concerned with the doctors and the hospitals and the providers, or they're trying to get the best deal and they'll make the network work, if that makes sense. But let's just say, for example, that this individual had indicated 2 facilities. What that tool will do for you is it will let you know that the first 2 plan options, the less expensive ones, are not in network, but the final plan, the most expensive one, has one of the 2 providers in network. I do want to reiterate, though, that use this as a guide, but confirm the information within the individual provider directories. I know from experience that this information is actually not accurate. And the reason it's not accurate is how the marketplace tool lookup works versus the individual provider directory tools. There's sometimes challenges with doctors' names or hospitals' names and how they are appearing in one place versus another. So be aware, this can be a helpful starting point, but you don't want to rely on it 100%. I'm going to talk a little bit more about this network cheat sheet as a tool that my team builds every year. This is essentially our last season's, our 2021 network cheat sheet overview, just that provides for all of the assisters on my team, but also for our clients, if they wish, kind of an overview of the plans next to each other, big picture, okay? So this is more detailed perhaps than y'all need. The county served isn't always a necessary element, but this is our 2021 example, and this can be very helpful when it comes to conversations connected to how the plans stack up. I also wanted to emphasize, so again, just when it comes to the different pieces of assisting a client, we have the selecting a metal level, right? That's a cost conversation. We have the known medical needs, be it medication or a physician. And this is a combination because this can come down to cost and network, of course, like what does it cost to go to this provider versus another. And then selecting an individual insurance company tends to be a network conversation. But selecting an individual plan for the most part, if there's more than one of the same plan option within one company, is of course going to be a cost issue. And what I would really reiterate when it comes to metal level, because clients do get confused, is that the metal level of a bronze plan with the same plan type in the same company is going to determine how or when the cost of care happens, not what is covered. Clients will sometimes be concerned that a bronze plan with the same company as a silver plan won't cover X. But of course, that's not quite correct. right? It will cover that same medical need, but of course, there might be a larger upfront responsibility from the client. So keeping this question in mind, which can really help a client sort of figure out where they want to be cost-wise and in terms of med levels. Is the client looking for something just in case of an emergency, or do they want a set copay for regular care? And again, another lovely, lovely illustration through Beyond the Basics. This kind of gives us a reiteration of what the different metal levels mean, right? And the silver level being sort of this in-between space where if someone's eligible for cost sharing reductions, that tends to be a quite good deal for them. And often I would say usually the place we start when it comes to education. Okay. So I'm going to talk a little bit about a couple of tools, and then we'll get to questions. So the tools I'm going to discuss are laid out here. The first, unfortunately, has nothing to do with plan selection, but I just want to reiterate it because we've seen so many issues with clients struggling with proof requests. There's a really beautiful Beyond the Basics plan comparison tool I'm going to encourage you guys to make use of. And then finally, I'll give a bit of an overview of our network cheat sheet tool. So firstly, we have seen a ton of clients struggling with income proof requests connected to the fact that they've lost all their income connected to COVID and they're using an estimate. And it has really broken my heart to see how many clients have just lost their tax credits because they're sending old tax information. So I want to highly emphasize an attestation, a statement that essentially says, here's what I'm projecting my income as for the year is sufficient. A client does not need to provide proof that they don't have, but they do need to make sure that proof connects with the actual estimate on the application. So please keep in mind, if a client's banging their heads against the wall, sending in 10 years of taxes that don't match the estimate, it's not going to work. An attestation, a simple statement that says, this is the income estimate I'm using for this year, will get this done. I cannot emphasize this enough. Secondly, I want to call attention to the marketplace plan comparison tool that Center on Budget Beyond the Basics has designed. It is really lovely. And I think the most important piece, as with any tool like this, is not to be overwhelmed by all the detail it asks for, but rather to use it along the needs of the client, right? You don't have to fill this whole thing out. It's not, homework for you. But when it actually comes down to comparing different companies for the client, this is actually a fillable PDF that you can complete if you're working remotely and email to the client if they still need to sort of chew on those different options. So you could actually kind of give them something to take away that emphasizes some of the pieces that they have concerns about. And you'll note this is available in a multitude of different languages, and it is quite useful for helping clients narrow down their options. So I wanted to mention just quickly this tool again, which is something that I spend a lot of time building for our team. And basically, this portion of it is relatively easy to put together. It actually is something I can put together just using the filter tool. But the intention is to have a sort of big picture overview of our local Central Texas marketplace plans and companies. So I wanted to quickly show you guys the one I'm working on right now for 2022. So the big challenge for me for 2022 is we're going to go from 6 companies to potentially 10. And one of our companies, and better, is going to go from offering 1 plan type to 3. So this is a little bit more work for me, but I like this. I'm the type of person who can engage in this to an extent that might be a little weird. But what I do with this is I use Excel. And essentially, you can see that I have different little fields built depending on what's important to my team. And for this specific overview, you can actually more or less find all of this information just using the filter tool. If you go into the plan preview tool a little bit closer to October, use whatever zip code makes sense for you and your clients, and then essentially move into the filter plan section. I believe this is Cook County. You can see immediately all these different pieces of information, the number of plans and the number of plans per metal level. You can also see the types being offered in your specific area, HMOs, PPOs. You don't have POSs or EPOs in this market, so you don't have to explain these to clients who are seeing plans here. Again, you also are going to get a sense of the names of the companies and can essentially start to put together a document that gives your assisters and also your clients a sense of how these plans compare. And using, again, potentially hospitals as a way of differentiating can be very helpful. But we have also used large in-network primary facilities. If there is a local clinic that everybody where you live uses, include that. You know what I mean? Include that as a column, as a yes or no for each insurance company and each insurance company plan type. It will save so much time. And note too, this can be a very helpful way to include some overarching reminders for your sisters. Like the emergency room care part is how I remind all my clients if someone has an out-of-network emergency, I want them to come back to us. I don't want them to navigate that on its own, because that is something marketplace plans guarantee. Okay, I suspect I am almost out of time. So I wanted to pause and see if there are any questions.
Thank you so much, Arianna. That was great. And we do have a few questions that came in. So I'll just read some of them off while we have a few minutes left. Where's the enrollment checklist that you mentioned located?
So it's located when you're actually when you're done with the eligibility letter, or you submit the application, you generate the eligibility letter, and then you move into the step of enrollment. It should be the very first thing you see, basically, in healthcare.gov.
Yes, thank you. So the system usually does the grouping automatically. You mentioned that it's possible to define the group manually. How is that done?
Yeah, so healthcare.gov or whatever exchange system you're relying on will generally group people in the simplest way possible. Usually, again, if it's husband, wife, and children, it will put them all on the same plan automatically. It will group them together. But again, right after, I want to say, the screen where you would input information on physicians and drugs, there's literally a space in which you can either view plans with the grouping that the marketplace has shared, or you can actually change the groups. So it's a blue button basically that says change groups. And then all you need to do is select one group one for one member of the household and group two for the second member, or however you want to divide them up. But again, it's part of that checklist as you move into looking at plans.
And what does someone do with the information on healthcare.gov regarding which hospitals and providers are in network? Appears to be inaccurate or confusing.
This is such a good question. And what I would recommend here is to recognize that there are so many different things behind that. What we've seen most of all when it came to sort of reaching out to a provider, an individual health insurance, saying, hey, this isn't up to date, was trying to figure out who needed to update it. Is sort of very messy, right? Sometimes, unfortunately, it's on the provider side, right? Sometimes it's actually something going on in the health insurance company's actual network. So my recommendation is not to rely on it, because we have not had a lot of success getting that fixed, either in the provider directories, frankly, or in the healthcare.gov tool. So this is why I emphasize building general tools where, if, for example, as I demonstrated, St. David's doesn't show up correctly in the marketplace directory for whatever reason, our workaround to that is a tool that lets our assisters and our clients know, in fact, this hospital is in network with these plans, simply because of the fact that we know it can be a little quirky. And I think as the enrollment season goes on, unfortunately, you guys will sort of all tend to be aware of what those quirks are. And rather than memorizing them, right, get those on paper and share them within your organization so y'all are all on the same page with some of those bureaucratic challenges.
So shifting gears a little bit, does someone who has met their out-of-pocket maximum still have to pay co-pays?
After you've met your out-of-pocket max, no, you should absolutely not have to pay copays for any, again, covered services, right? So you need to still be availing yourself of services that the plan actually covers, and you need to still be going in network. But once you have hit your out-of-pocket max, you should no longer be paying copays for any services. Now, be aware sometimes that what happens is that when a person has met their out-of-pocket, there's sometimes a delay in that information being communicated to the health insurance company and being communicated then to the provider who might be accidentally charging a copay, right? But suffice it to say that should be sorted out. So a provider should eventually recognize that the client has been charged a copay they shouldn't have been charged and should refund that. Sometimes it's just a matter of the gears getting greased, if that makes sense.
On the page that lists all of the plans, how do you know whether a listed copay for something like generic drugs is before or after the deductible?
The summary of benefits, I would say, is your best way to be 100% sure. And it should specify that. And the challenge, I think, is that while the Affordable Care Act has sort of standardized the layout of the summary of benefits, the verbiage when it comes to the deductible can be a little tricky. Sometimes it will say things like with deductible, after deductible, deductible does not apply, deductible does apply. So sometimes it takes a little bit of sleuthing around, to be super honest, to exactly figure out the language the insurance company is using here is pre or post deductible. But usually you can take a look at the lower tier language versus the higher tier language. And again, especially with the Silver Plus plan, and even with certain bronze plans, assume that if there's a differentiation when it comes to the deductible, that with the generic or lower cost plans, this is usually the deductible not applying. And then if there's different language with the higher tiered drugs, this is going to mean the deductible does apply for the specific insurer. But I am also more than happy if you see something funky in a summary of benefits or verbiage connected to deductible applying or not applying, I would love to see it and offer feedback, because it can be very finicky. And sometimes common sense isn't enough to help us with what it means. Sometimes you just need more eyes on it. So feel free to send that my way.
Great. Well, thank you again so much, Arianna, for this fantastic presentation. And as a reminder, we'll be distributing the materials from today's session via email, and we'll post everything to the Beyond the Basics website. The next webinar in this series, next webinar in this series will cover how the redetermination and renewal process works on healthcare.gov for 2022 plans. The webinar is scheduled to be held this Thursday, October 7th at 1 p.m. Eastern, 10 a.m. Pacific. And you can register for upcoming webinars on the Beyond the Basics website under upcoming webinars. If you have any questions or need assistance, please email our Beyond the Basics contact email at beyondthebasics@cbpp.org. And with that, we'll bring today's webinar to a close. Thank you again, everyone, for joining us today.